Hello, I'm Dr. Mugdha Raut, a practicing obstetrician and gynecologist and a clinical reproductive immunologist. We have our centers, Dr. Raut's Center for Reproductive Immunology in Mumbai, Nagpur, Pune, Delhi, Bangalore and Hyderabad, where along with my husband we treat couples with unexplained repeated miscarriages, unexplained IVF failures and unexplained infertility with the help of lymphocyte immunization therapy and other passive reproductive immunomodulatory treatments. Today, let us see how do we evaluate and diagnose patients of repeated miscarriages. Now, as clinical reproductive immunologists, we usually see patients referred by gynecologists and IVF specialists. And majority of these patients have undergone all possible known tests to evaluate the causes of recurrent miscarriages. Today, let us only enumerate what are the tests required for a patient of repeated miscarriages. Now, typically, I start by taking a detailed medical history and advise a set of investigations if not done. These investigations include blood tests, which include the test to find out blood sugar and HbA1c for diabetes, T3, T4, TSH for thyroid disorders, FSH, LH, AMH and testosterone for PCOS. Then there are the tests to detect the acquired thrombophilia like APTT, lupus anticoagulant, anti-beta-2 glycoprotein antibodies, anti-cardiolipin antibodies, anti-phospholipid antibodies, etc. Congenital thrombophilias are rare but can be diagnosed by the MTHFR gene testing, factor V laden, antithrombin 3 tests. Autoimmune problems can be diagnosed by ANA, dsDNA, etc. After blood tests come the genetic testing. Now this involves a karyotype and microarray testing of the products of conception and parental karyotype and microarray testing. Next set of tests are ultrasound and imaging. This involves ultrasound evaluation of the uterus, preferably 3D ultrasound for congenital anomalies of the uterus like septate, bicornuate or unicornuate uterus or acquired problems like fibroids, adenomyosis or uterine polyps. Endoscopic evaluation by hysteroscopy helps to detect a septum or a bicornuate or a unicornuate uterus. Endometrial biopsy can help detect any issues with the uterine lining like endometritis or tuberculosis. However, in spite of all these tests, in almost 50% of cases of recurrent miscarriages, the underlying cause cannot be found out and they are labeled as unexplained repeated miscarriages. Now it has been understood that in these so-called unexplained cases, the underlying cause is alloimmune disorder, meaning immune reaction against the developing embryo or pregnancy. To confirm this alloimmune factor, certain immunological tests can be done. These tests that we recommend at our reproductive immunology centers are lymphocyte cross-match, NK cell estimation in the blood, serum TNF-alpha and endometrial CD57 cells. Negative lymphocyte cross-match, raised TNF-alpha, raised NK cells in the blood, presence of CD57 cells in the endometrium indicate alloimmune problem.